come forward. Yes, as the Spirit leads you, I'm giving you 3 minutes each. 3 minutes for each one of you to give us an overview of how UoN and your training has impacted in the university where you are now. Okay? So welcome. Who is starting? Dr. Kagia is the Spirit has already moved him. Welcome, Dr. Kagia. He'll be followed by Dr. Karara and then Dr. Susan. So Dr. Karia is an alumni of UoN. He actually graduated as best student in the year 2012. Best student in CHS. Welcome, Doc.
Good afternoon. So my name is Richard Kagia from Kabarak University, and I'm very delighted to be here today. And looking at the people who have been ahead of me, I'm really delighted to see my professors here. It has been a wonderful time coming back to University of Nairobi. But just to answer the question, how University of Nairobi has impacted Kabarak University. Number one, more than 50% of our staff are alumni of Kabarak, of University of Nairobi. More than 50% of our staff. And with that, we have been able to do a lot of work at Kabarak University. One, we have revolutionized our curriculum where it is patient-centric. When we come to clinical pharmacy, they normally have a full day in the ward rounds interacting with patients to make it patient-centric. Number two, we have pharmaceutical manufacturing. We have pharmaceutical analysis. It is well endowed. The curriculum is well endowed. And partly it's because of all these alumni who came from University of Nairobi, got good training, and are now reflecting the training back at Kabarak University. Number two, we have been privileged enough, one, to launch a Master of Pharmacy in Oncology Pharmacy. This is in partnership with, thank you so much, this is in partnership with International Cancer Institute, and some of the faculty who train the Master of Pharmacy in Oncology Pharmacy, 60% are alumni of University of Nairobi. And our graduates of Master of Pharmacy in Oncology Pharmacy rotate in the hospital, referral hospital, for 1 year. All the oncology preceptors that are engaging our Master of Pharmacy are alumni of University of Nairobi. So you can imagine how University of Nairobi is really helping us at Kabarak University. And also, God willing, we are launching the Master of Pharmacy in Pharmaceutical Manufacturing. We were inspected by CUE and we got a good report. So hopefully soon we'll be launching it. And even in the area of pharmaceutical manufacturing, quite a number of our lecturers, led by Dr. Sarah Bugigi, I know you will meet her. Also, we have Dr. Elizabeth Ogaja, we have Dr. Othiambo, just to mention but a few of alumni of University of Nairobi. So just to say that even though we are young, we are trying to follow in the footsteps of University of Nairobi, but we are praying that we will overtake University of Nairobi. Otherwise, with that, I rest my case. Thank you very much.
Good afternoon. My name is Dr. Monica Carrara from the School of Pharmacy, Jomo Kenyatta University of Agriculture and Technology. I'm a chair of department of pharmacology and pharmacognosy. And I was just reflecting on the journey of establishing the School of Pharmacy at JKUAT. And what I can say is that the University of Nairobi has played a very big role from the development of the curriculum. And just like Kabarak, if you look at our faculty, for example, I'm in a department with 8 staff members. Actually, I can say 100%, all of us are from the University of Nairobi. Okay. Our founding dean, she's Dr. Jocelyn Kamau. She's actually an alumni of the University of Nairobi, and she was actually a valedictorian. So we have one of the best. Okay. We're also growing, just like University of Nairobi, we are developing master's programs. One of our coordinators for the master's program, he's Dr. Godfrey Mayoka. You know, he's looking for collaborations all over the world, Cape Town, Germany, and very soon we are going to launch a Master's of Science in Drug Discovery and Development. Currently, he's in Germany, and he's a proud alumni of the University of Nairobi. Yeah, that's where we are. Sorry? Oh, by the way, yes, Dr. Paul Mwaniki, he was my classmate in the year 2001. That is when we graduated, undergraduate. I did not say that I'm a clinical pharmacist. I did my master's at the University of Nairobi, and I am about to graduate with a PhD in clinical pharmacy. I have been guided so well by so many of my professors here, Professor Okalebo, Dr. Peter Karemi, and so many others. So the things that University of Nairobi has done for us, they are countless. Yes, thank you.
Okay, so my name is Dr. Susan Nyabate Mageto, and I'm extremely humbled and proud to stand before you today. I'm very happy because I can see my mentor here, Professor Ndemo. He has really held my hand through my journey. So I am a clinical pharmacist, okay? I did my training at University of Nairobi. I can see my lecturers here. Professor Kalebo was one of them. Dr. Gwantai has left. I was taught by Dr. Karimi, who was also one of my supervisors, including others. So a lot of things have been said here, but what I can say about the role that that Nairobi University has played in the development of pharmacy at Kisii University, if I start, then we might have a whole book, because I am well aware that Professor Ndemo here, Professor Kibwage, and our senior colleague here, Dr. Atebe, who's not here, were the pioneers of that course at Kisii University, and they had to go through a lot of hurdles to ensure that that course had been launched at Kisii University. So apart from that, I think all the lecturers that we have at the Kisii University, they are all alumni of Kisii of Nairobi University. So you've contributed immensely to us. So one of the things that has not been mentioned here is the research aspect. So I think I learned very well how to do research theoretically and even practically because of what I've learned here. And so far, I am a PhD student in pediatric oncology from so I'm a PhD candidate, probably graduating next year from Vrije University in the Netherlands. And I am currently doing my research at Moi Teaching and Referral Hospital. And of course, most of the people there are still alumni of Nairobi University. Okay, so you've contributed immensely to the expansion of pharmacy education in this country, and we are very grateful, and we hope that you will continue contributing. Thank you so much.
For those who don't know this face, I know Anyanga from college days. I think he was 1 or 2 classes ahead of me. Bururia there was a class ahead of me. Professor Gwantai taught me in pharmacology. I think she was just starting her master's program. She was a, what do you call, before they become lecturers, they are what? Tutorial fellow. I think that's how they used to call them. Gilbert, thank you very much for talking about what should be talked about every day. That our agencies are not as a result of we don't know, because you know a lot of technical things. I've been with my friend there, Chair PSK. And every time I go to their meetings, because I also have some meetings, by the way, for the students, I'm an alumni of Nairobi University. I did my master's in an MBA in Phoenix University. I'm doing strategic management. And so management is at the core. I'm teaching management at the Mount Kenya University. And I have fantastic students. To say what Nairobi has done for pharmacy training, Kagia was at Mount Kenya University, just to show you what MKU, but we trained him at MKU how to run a university. Dr. Karanja at Kisii University, we taught him management. Now he was able to establish a university in Kisii. I think he's the dean now. Right. So, Kokwaro on waste. This country can survive on 30% of what it uses. 70% goes to waste. It's unfortunate that we don't have managers in this country. He was talking about the functions of healthcare. General management, one of the main functions is planning. The other function is organizing. The other function is motivating people. And finally is to control what you're doing. Even before we talk about the processes that we do every day, in this country, I'm sorry, I'm not a politician, but I'm in management. I'm yet to find a ministry of planning that does its work. At Independence, we used to have a ministry of planning and national development by somebody called Tom Boy. And they did a fantastic job of planning the country. I'm yet to hear whether there is still any planning or whether we wake up and do what we want to do with the resources that we have. Now, on answering on not inefficiencies, availability, although we are allocated less than the ideal 5%, for the students, I think this is for you. Don't panic. There is hope. And where is the hope? Is that if we address the domestic front, let me just give an example, and I'll take only 3 minutes, Professor. If you take your calculator, I have 1 acre, right, of land, and I have 5 crops I can do, all factors kept constant. I think we shared this with Professor the other day. If I do maize on 1 acre, the maximum I can get is 15 bags in Kenya today. At 3,000 shillings per bag, the maximum I can gross 1 crop is 60,000, right? Or thereabouts. If I do cabbage, all factors held constant, I can put 20,000 pieces of cabbage in 1 acre, right? At 10 shillings per cabbage farm gate price for the students, how much can I get? I have 20,000 cabbages. At 10 shillings, how much do I get? How much? 200. But in 1 year, how many I can do? Let me do two crops of cabbage. How much do I get? 400,000 compared with 60,000. That's the same acre. Now, let's do another crop. Let me do spinach on 1 acre. Let me put down 20,000 pieces of spinach in 1 acre, right? Now, cabbage I remove, spinach I cut and leave the stem, isn't it? So the roots go deeper. Suppose I just do 2 cuttings for 10 months of spinach, and I only pull out 3 leaves per stem, and I get 5 shillings per 3 leaves of spinach, right? Twice per month, 10 months. The first 2 months I will ignore for germination and growth, right? The last 2 I will ignore. I mean the last one and the first one and the last one. So if I do 10 months, how much will I gross? If I've been on that stem 20 times in a year, and I'm doing every time I'm doing 5 bulb. I'm just waiting for the students here. I'm trying to test whether my Form 2 mathematics, maybe he has done faster. How much am I grossing in 1 acre on spinach? No student can do that quickly for me. Yes. It's twice per month for 10 months. How many times have I been on the stem? 20 times, isn't it? So how much is that? 2 million, right? So I have 1 acre. I'm getting 60K, 400K, and 2 million, isn't it? Now, sisi zote tuko hapa tunalia pesa. Mjinga ni nani? So every time I hear there is rain in some part of the country and the rod is lying idle, are we together? We must change our what? We must change, it's in our head. Anyway, that's why I was coming to summarize for you. The difference between what we want and what we get is between our ears. Because sometimes we read the newspapers and the newspapers contain a lot of the negative stuff that happens in the country every day, right? So it's possible we can reduce our inefficiencies, right? By creating more resources. Most of the countries that have developed because they develop their human capital. Now, let me come to the pharmacists, and that's why I was a student and I was representing the country in Uppsala, Sweden. International Pharmacy Students Federation. I was the only guy from Africa to make a presentation. I hear it's coming here. It's coming here this year. I may not be in a position to, but the point I'm trying to establish is that there is hope. Don't read the negative stuff in the papers and start throwing stones. Use what is between your ears and change your circumstances almost immediately. And finally, yes, start learning management courses. Okwara started in Strathmore. We are trying to do it in MKU. I think our students sometimes, not always, leave out changed. But for those of us who belong to the technical staff, Dr. Moneki, every time I come for the meetings, that's where I was coming to. We are talking a lot about administrative issues and non-technical issues, right? Figures are technical issues. The processes can consume a lot of our time. The outcomes, especially of healthcare, are still challenging. We buy medicines that expire, we overstock our hospitals, we burden our pharmacists, yet the patients to whom those medicines are dispensed are not taking them. Compliance is a big problem, and it happens outside the hospital. So there is a lot of patient education which must be done by the pharmacist, who is the last person to be seen. Because that contact, 3-5 minute contact, means a lot as far as compliance is concerned. Thank you very much.
Of wisdom and best wishes as you continue to mentor the students. So we are going to give one opportunity to one online speaker. Hello, Dr. Maru, are you there?
Yes, Professor.
Great, and you're actually loud and clear. Go on.
Can you hear?
Yes, you're giving us an overview of how UoN has impacted the USIU environment in training of pharmacists. Welcome, Dr. Prof. Maru. Thank you.
Yes, for those who don't know me, I am Professor Shital Maru. I am the Dean, School of Pharmacy and Health Sciences, currently at USIU Africa. I'm very much part of University of Nairobi, taught since 2003. So it's been around 22 years at UoN teaching. I did my PhD, supervised by my great professors, Professor Kibwage, Professor Kokwaro, and Professor Kuria, who has retired. I had worked in administration for a long, long time. I've taught quite a number of you across. I'm a very new dean. I've clocked 1 year, and I'm on unpaid leave of absence from University of Nairobi, trying to provide leadership and, as Prof. Kokwaro said, stewardship to this institution at USIU. Currently, we have BPharm, Bachelor of Pharmacy. We have been given approval for masters in health supply chain management. We've been given approval by CUE for masters in pharmacology and toxicology and pharmacognosy. And we're soon going to get approvals for other masters, especially in pharmaceutics. I'm one of the academic leads in starting Master of Pharmacy in Industrial Pharmacy at UoN. And I've developed, I think, quite a number of lecturers who are teaching pharmaceutics in the other universities. For USIU Africa, quite a number, almost 40% of my faculty have trained at University of Nairobi. Even till now, we have adjunct, we have consultants from UoN who support us in delivery of our programs. So University of Nairobi, you are our great-grandmother university, and we look forward. In fact, as we are growing, we are expecting University of Nairobi to show leadership and stewardship as well. And I look forward to seeing and meeting you, some of you, very often. I look forward for collaborations. We have some very good collaborations. Sorry, I could not come physically there because I'm hosting the president for MasterCard Foundation Scholars Program, who's come from the US, and she's called Dr. Rita Ray from the US, because our headquarters for MasterCard Foundation is at USIU Africa. We are not very far. We are on Safari, behind Safari Park Hotel. You can come visit us one of these days because we have state-of-art R&D facilities. Soon also launching the biomedical research unit, which is costing us around 165 million Kenyan shillings. We've also had collaborations with Purdue University, and they're coming on board this June. In August, we have the famous International Pharmaceutical Students Federation conference, the first time in Kenya, which is hosted by USIU Africa, or as you know it, UCU. So we welcome you and your students to USIU Africa in August, and hope to see some of our faculty as well there with the deans and other faculty. Thank you so much. Prof. Kokwaro, greetings to you. My mentor, Professor Gontai, I literally take mentorship as a dean from her. Thank you so much.
Prof. Maru, for that elaboration, and we are really very grateful for the invitation. We shall try to be there. So, my dear audience, as we try to finish in the morning, I think we are over our time. It's actually, we are in the lunch hour time, almost completed our lunch time, and we are still here. So I will give this opportunity now to close up this session to Dr. Mwangi, who is our chair who was our chair in the morning session. He has some announcements to give us, and he'll also give us direction as to how long we have the lunch break. Welcome, Dr. Mwangi.